Hi, my name is Tyler Sylvie. I am a senior in my last semester at Lincoln University. Today is August 30th, 2018, and it is 10 o'clock in the morning. Today I will be talking about patient education and chest tubes. Before entering the patient room, I would perform hand hygiene, introduce myself to the patient, confirm the patient by two identifiers, name and date of birth. I would explain to the patient why they have the chest tube, why it's necessary, and how the system works. This patient needs a chest tube. You have a chest tube in place, sir, because you either have air, fluid, blood, or pus in your lungs, and what can happen is when those things get in there is it can make your breathing ability harder because your lung is not able to expand as much as it regularly should. So by placing the chest tube, we were able to relieve that fluid out of there, change the pressure so the lung can expand. The chest tube is sutured into place in hopes that it doesn't fall out. It's important to, as a nurse, to have a dressing at bedside, to whereas if it does come out, we can plug that thing up pretty quick. The tube runs down into the Pleurovac system here. This is a system. This tube is typically connected to suction, which we're going to pretend that it is per physician's orders. The Pleurovac is made up of 3 separate chambers. This chamber here is the fluid collection chamber. So any fluid that is in the pleural cavity would drain here, and this lets us be able to assess the output of the fluid. And so at each shift change, you would document on the side here, you would write your name and the time, so the oncoming nurse will know how much fluid they were at shift change. And whenever these things get full, you have to get a new one. You cannot reuse these. So you would get a second pair of hands and clamp the tubing and change this out, and then this would be put in the biohazard containers. And then, so that's one of the 3 chambers. The second chamber is our suction chamber, which we have kind of already talked about. And then lastly is the fluid chamber. In these kits, there comes a little bottle of fluid, and there's a hole back here that you pour that fluid in, and that fluid turns blue. And what this is that is your air seal. So we want the air seal to almost be moving kind of like a wave back and forth. And that lets us know that we have a good seal, there's no air leak. If there are bubbles in the air seal chamber, that lets us know that there's a leak somewhere in the system, and so we would need to act on fixing that. It's important to educate the patient and family members to look out for this. If it's sitting on the ground, it needs to be on a level floor. It cannot fall over. If the system falls over, then you have to get a new one and you have to set it all back up again. They come with these handy dandy handles that you can put them on the end of the bed. And it's important, with one of these that you are continually assessing the patient's respiratory status, because if anything goes wrong with this, the respiratory status is going to start showing some problems.